also taken, it's a big intersectionality here, a big interest in obesity, and it's the same thing. Getting people to turn up, show up, and actually, get engaged is very hard. So I am a commissioner, but I've not been as good as I have been, and I'm sitting, as I should be, as I'm sitting listening, I'm like, okay, I've got to step up and do more. But that is the problem, is that we all have so many demands on our time, and you come away from a meeting like this enthused and like, I've got to get really, campaigning on it, because that in the end is what we've got to do. I was talking to a couple of medics earlier, and they said, yes, but you're the ones with the influence, and I'm like, well, I wish that were the case. But anyway, it has inspired me to do more. Dan mentioned that obesity is being dealt with. It absolutely is not. All these harms, all these addictive harms are still, gambling a bit more, yes, but I'm also very involved in the porn debate, and I was just saying how addictive that is. I mean, if you believe that you've been born with an addictive personality, there are so many rabbit holes down which to go. How do you get through life unless you are born with a steady character without being sucked into so many of these issues? I got involved because Baroness Finlay, who's not here today, and I campaigned when I was newly in the Lords about 10 years ago. We persuaded, actually she said to me, I won't go because I know I annoy Ken Clarke, so you have to go, to persuade him to do the tagging. And it hasn't had as much publicity as it should have done, because it's been a highly effective deterrent for people who are, and it was designed, the alcohol tags were, it's actually called sobriety tagging, I think. And I'm on a WhatsApp group with a lot of other ministers. I say, can I have an update for tomorrow morning? But because they're not AI, they didn't reply to me in time. But I know it's been a highly effective intervention, and that I've also know that there are people who are being tagged. Obviously it keeps you out of prison, keeps you out of hospital, you have to stick to it, it works, and it's not an expensive intervention. It's reduced domestic violence massively. I know there are people who've been tagged who say, please can I stay on it, because it's actually a very effective way of keeping me off the alcohol, keeping me in employment, keeping me out of trouble. But anyway, I went to persuade Ken Clarke when he was Justice Minister, and thanks to a very enthusiastic SPAD, we finally got them over the line on that. My colleague James Bethel, who sadly has a tooth crisis and hasn't managed to get a dentist appointment, so can't be here today, he's been driven into it because his own mother drowned in the bath when he was 7 from alcohol and drug harm. So I think many of us in this room and elsewhere are driven to campaigning and interest in the area, and there is hardly anybody in the country who's not touched by the issue. As I say, I just mentioned to Andrew, it is the worst of the drug and the worst of the addictions, because once you start, we all know. I can resist snacks until I've had a drink or two. I don't actually want to go down to the bookies after that, but I know so many people who would, or would stumble into doing the inhibitions go. We don't have to spell it all out. We just know what it leads to. And I think anything any of us can do, both in Parliament, the waste, it is just horrifying, the waste of early deaths. I was slightly encouraged by talking to someone this morning that the worst of the generations is us, it's the baby boomers, probably because we can afford to, and that the younger generations are perhaps not as well, I hope this is right, but not as inclined to preload and as the previous generations. So there is a bit of hope there, and looking on the hope side, we know there's no one silver bullet, but obviously, as Dan's so rightly pointed out, the labelling, the advertising restrictions are the way we should be going, and I think the encouraging evidence from Scotland on the minimum pricing should be pretty compelling to the Treasury as well as to our health service. So I just thank you all. You all know far more. Ian was saying earlier he was asked to give a lecture where he didn't know much about it and typed it into the AI and got a very good response back. I should really have done that, because I know you all know far more about it than we do. But I will give a commitment and you must keep me to it, that I will go back and be a more active commissioner and a more active campaigner in Parliament in order to get some of these harms dealt with. Thank you very much for your